It gives me great pleasure to introduce our next speaker. He was confirmed by the U.S. Senate as Secretary of Veterans Affairs on February 13th, 2017, unanimously. How often do you ever hear of a Senate agreeing on anything, 100 to no votes? How about that? Prior to confirmation, our guest served as VA's Undersecretary for Health, leading the nation's largest integrated healthcare system with more than 1,700 sites serving almost 9 million veterans. A physician himself, he has held numerous chief executive roles at Morristown Medical Center, the Atlantic Health System's Accountable Care Organization, and President and CEO of Beth Israel Medical Center in New York City. He has been named as one of the 50 most influential physicians executives in the country by Modern Healthcare. Please give a warm American Legion family welcome to the Secretary of the Veterans Affairs, Dr. David Shulkin.
Doctor, good to see you again. Good to see you, Mr. Secretary. Thank you for being with us today.
Great. Well, thank you, and it's great to see all of you. And Commander, thank you for that warm welcome. I don't think the commander has been home in a long time. No one works harder traveling the country, caring about and visiting people. I just want to thank you for everything you're doing, and wanted to recognize and say hello to Mary Davis and Jeff Frayne and Bill Oxford and Mr. Clay. So it's great to be here. You know, the American Legion is such a important organization, not only because you're the largest, but your commitment and passion for everything that people do and you do for our veterans is so important. You have such great leadership. I certainly want to recognize and thank Verna Jones. I can't imagine being led by a more able and competent leader. And I don't think there's anybody who knows more about what's going on in Washington than Lou Celli. I know he's constantly telling me what's going on, and I appreciate it. You guys are really so capably led. I wanted to talk this morning about modernizing the VA, and as the commander said, I've really been secretary now for just about 2 weeks. I think 2 weeks today. And but it's really important that we get on with this task and that we do this very, very quickly because this is long overdue. So let me share a few thoughts with you. It really is just such a tremendous privilege and honor to be able to lead this department with the mission that we have, because it is the best mission in the federal government, obviously one that you share, which is making sure that those who have gone and served our country are getting what they deserve and have earned. I believe that the VA system is a unique system, certainly not only a system worth saving, but essential for veterans and for the country. And I'm reminded, having come from the private sector, how important it is and different that we have a system that cares specifically for veterans. I come from the hospital world, and many of you may have had a chance to see what we call the final salute in the VA healthcare system. When somebody passes away, being able to honor and respect the life of a person who served their country in a way that's distinct. You just don't see things like this in the private sector. We also have to remind ourselves that when you go out into the private sector, that the type of care that you get isn't always the type of care that our veterans need. Only 1 in 5 providers in the private sector actually have military competency, and in mental health, only 13% of those in the private sector really understand the environment that people come from. So if you're getting treatment for PTSD and you tell your psychologist or psychiatrist that it was a result of an IED, and they say, well, what is an IED? You can see that that may not be the right environment to get the best help in. And so when I came from the private sector to the VA, and I actually started to practice in the VA healthcare system, I recognized just how different the VA is from what you get in the community. In the VA, there's peer support. We have crisis lines, transportation, caregivers, finding veterans' homes if they're homelessness, all sorts of things that, frankly, are a much more comprehensive approach to care than what you would find in the private sector. And these are some of the reasons why I think it's so important that we keep a strong VA. When I had a chance as Undersecretary of Health to go out and to visit some of our adaptive sports programs, I don't know how many of you have ever been to these programs, but where you take people out of wheelchairs and have them ski down mountains, such as what we're going to do again next month in Snowmass near Aspen. Or this summer when I was with veterans who were out there surfing, and you begin to start seeing how important these types of activities are to the well-being of our veterans. These are unique services that are offered in the VA system. Our use of technology is also unique. This is actually a picture of me practicing from my office in Washington, where I see patients in Grants Pass, Oregon, using telehealth, using technology. And I had not done this in the private sector, but this is routine in how we deliver care, particularly to rural veterans. No one uses technology the way that VA does. 9 million episodes of telehealth. Even in telemental health, 336,000 visits. And in intensive care units, places that could never have full-time intensivists or critical care doctors, the VA is able to use technology to bring that expertise even to small rural VAs. So this is something, again, that's somewhat unique. I think people understand that the VA system takes care of patients, does research, trains doctors, but they often forget about our fourth mission, which is to be there in case of a catastrophe for the country or a national emergency, whether that's a medical emergency that might happen or a military emergency that may happen. We are the backbone, that safety net for America. And we're there, we train for this. We actually deployed 8 times this past year in national emergencies, but we are there and we practice for this, and people forget that how vital that is for the country. Now, in terms of modernizing the VA system, really where my focus is, I always think it's important to remember that VA has historically contributed to not only healthcare, but to all of America. So I date this back to the Civil War, which, as you know, was the bloodiest war that we fought in this country. It was sort of hand-to-hand combat, and the types of injuries that were happening on the battlefield were really quite remarkable because it was close range, either bayonets or shotguns. And at the time, on the battlefields, the doctors were learning so quickly how to manage these types of traumas that they were writing their essentially protocols for how to treat trauma. They're writing them so fast and adding them to the book that the binder that they were keeping on the battlefield broke open. And the only way to hold the book together was to wrap it in red tape. So the VA is the originator of red tape. And we brought that to all of America. Now, but when you look at history, there have been lots of efforts to modernize the VA, lots of commissions, lots of studies, and that's often a popular approach to how to fix something. Let's go out and study it, get some experts. I've counted 140 of these assessments that are sitting somewhere on a desk in VA. We don't need any more studies or commissions, recommendations on how to fix the VA. What we need to do is to begin the work and execute it and really focus on that. So that's exactly what we're going to be doing. We're going to be streamlining this organization, getting rid of the red tape, the regulations that prevent us from providing the type of services that you need. And where we're going is exactly where both Dr. Rowe and Senator McCain talked about is to take the best of VA and the best of the private sector and make that one system that essentially works for veterans, and that's our focus. Now, specifically, my priorities as Secretary are going to be these 10. Dr. Rowe talked about legislation for accountability. I couldn't agree with him more. that when people lose their values and have deviated from the ethics and the values that we all hold dearly, they no longer have the right to work in the VA, and we're going to make sure that they don't work in the VA. And Senator McCain mentioned the choice program that Congress was able to authorize 3 years ago. That does expire this August. We need to see that legislation extended beyond August because we need those resources to be able to provide the care for veterans that they deserve. So we're seeking that extension, and we're working with Congress to make sure that happens in the next couple weeks. But then what we want to do is we want to come back and we want to redesign the choice program so it actually works for veterans. We know that this program was way too complex. There were too many steps to be able to go out and get the care that veterans needed. And so until I can think of a better name, we're calling it Choice 2.0, but this is really meant to make this program work better. It clearly means that we're going to need to eliminate the 40-mile, 30-day rule. As I tell people, if I were designing a healthcare system, I wouldn't have thought about necessarily picking it based on mileage and wait times. There are better ways to deliver care. So we're going to make sure that that gets done, and the President is committed to that as well. I think when you talk about modernizing the VA, you know that our facilities are old. They are not representative of what we want, the environments that we want our veterans cared in. We're going to be looking towards investments. We're going to have to make some choices. There are some parts of the country where buildings are sitting empty. There's no sense in keeping buildings empty. So we're going to consolidate where it makes sense, but we're going to invest in world-class facilities. And again, we have a commitment to do that. Enhancing our foundational services, by that I mean exactly what Senator McCain was talking about. There are certain services that frankly VA does better than anybody. I want to make sure that we continue to be on the cutting edge, that these are the top services available in the world, and we're going to continue to invest in those. We need to work closer with the Department of Defense and other federal facilities. I'll show you in a little bit a map of where VA and DOD intercept. And frankly, DOD needs us, and we need DOD, and Secretary Mattis and I are going to be working closely together to make sure that we're maximizing our ability to work together. Our IT systems, as Dr. Rose said, we have been a leader, but these systems desperately need modernization, and we're going to take those steps too this year. Suicide prevention, again, what Senator McCain was talking about. Our top clinical priority right now is suicide prevention. Appeals modernization, we're looking for legislation to be reintroduced in the 115th Congress to get that system fixed. You should not be waiting anywhere near the period of time that people are waiting to get their appeals heard and decisions made, and until we get a legislative fix, we're not going to make the progress that we need. So we are looking to see that done this year. And lastly, on the benefits side, although we've made tremendous progress, we still have much more that we can do to get faster decisions. And so I just want to highlight a few of these things that are really important in modernization. Infrastructure, the way we work with the private sector, improving quality, because that's really important, and keeping VA unique. Now, for those who have worked with me for years in the private sector, when I ran hospitals before coming to the VA, I was often known as being relatively impatient, and I think that's true. I would say to my hospital teams I was working with, look, I want this done now. What's it going to take? An act of Congress? And now, ironically, everything I do takes an act of Congress. But I'm getting used to it. When I talked about the infrastructure, you can see on some of our VAs today, we actually have buildings standing from the 1800s. And so I think everyone recognizes that this is going to require a new level of investment to be able to get our facilities to look like, at the bottom right-hand corner, what a contemporary modern hospital should look like. That's our Palo Alto facility, single rooms, beautiful facilities, able to have family members stay with them. That's what we want for every veteran. This is our VA DOD map that we look at now closely, how we can begin to work closer with the Department of Defense. I've talked about our ability for VA hospitals to begin to start working together with community providers. This is what I call the integrated approach of taking the best of VA and the best of the private sector, and this is really our vision for the future. When I look at progress and whether we're making progress, I look at these 4 areas: quality of care, whether we provide access, whether we're making progress in the areas that are important to us, like suicide, and finally, and most importantly, what our customers, what the veterans say about what they're experiencing about VA. When it comes to quality, we measure quality very comprehensively. I'm pleased to say that last year, 82% of our VAs made significant progress in the quality of care. And it's not just VA who says that. When independent groups look at our quality, like the RAND group, and they report on this, they find that the quality of care in VA is as good or better than what you would find in the private sector, and that's important for us. VA continues to lead in important issues, not only to veterans, but to all Americans. The opioid crisis, VA began work on this well before it was recognized as a national crisis. We've seen a 22% reduction in the use of chronic opioids. In hepatitis, I'm also pleased to say, but by the end of next year, we will have been able to treat every veteran who has hepatitis and wants to receive treatment for that with a 95% cure rate. So no other healthcare system will be able to do that. Overall, last year, a 20% reduction in risk-adjusted mortality. Our productivity, people working harder, up 12%. That's a major increase. And even in VBA, where our call centers a year ago, 59% of our calls used to be blocked. In other words, you couldn't get in to speak to somebody. Today, that number is less than 1%. So we are making important service improvements. What we're trying to do now is to make it easier for you to see our progress, so you're going to see much easier comparisons to the private sector rather than complex government reports. We're working to make our results more transparent to you and easier to understand. In terms of access, and Senator McCain was talking about this, and this of course started in Phoenix. When I came to VA about 19 months ago, we had 57,000 veterans that were waiting more than 30 days for urgent consults. That was totally unacceptable. Today, that number would be close to 0. We have really focused on making sure when you have an urgent care need that you get the care not in a couple days, but you get it right away. We have same-day access now in every one of our VA medical centers in primary care and mental health. So if you have a medical problem or you have a mental health problem, your VA medical center would be able to take care of that issue today. And that's important so that we don't have people waiting for urgent care needs. In terms of access, 96% of appointments are seen within 30 days, 86% within 7 days. So we would compare this to any other private sector setting. We think that we're as good or better, but we're not satisfied with where we are, and we're continuing to work on this. When veterans come to see us in our VAs, 90% say that they're satisfied with their care. That 10% is still our opportunity to do better, but it's important to recognize that we are asking you how we're doing, and you're letting us know how we're doing. In homelessness, we saw a 46% decrease in veterans' homelessness since we started our efforts on this in 2010. Last year, our biggest decrease in homelessness, a 17% reduction last year, and we will continue to focus on this until there are no longer homeless veterans. In VBA, the benefit side, in March of 2013, we had over 600,000 claims waiting more than 125 days. Today, that number is less than 100,000, but as I said before, we're not satisfied with that. We're going to work to make sure that we get that even to a much lower number, and we're looking at ways of modernizing our benefit system even further. The Cemetery Association, highest customer satisfaction in the country by the American Customer Loyalty Index, 96% satisfaction rate. So we're very proud of the services that we're able to do. I mentioned suicide as our top priority. You're going to see new initiatives come out of VA in the next couple weeks. we're going to be working with our community partners to do as much as we possibly can, and we do need help on this. I just wanted to
I'm good.
I'm good.
show this.
I'm good. But I have a story, and I don't know where to start.
I'm good. But I feel alone in a crowd.
I'm good, but nobody understands.
I'm good, but the past keeps coming back.
But I can't get out of bed.
But I can't sleep.
I'm good, but I feel overwhelmed.
I'm good, but I don't feel safe.
But I don't even know who I am anymore.
But I still have nightmares. But I don't need any help.
I'm good, but I don't feel anything anymore.
I'm good. But I can't live like this anymore.
I'm really not so good. But are you ready to listen?
We're trying to get the message out. We've added hundreds of new veterans crisis line responders. We are looking, this is our top clinical priority right now. We continue to innovate and find new ways to do better jobs. That's what good organizations do. We were named the 11th most innovative organization in the world as measured by patents and publications and presentations. You're going to see some of these innovations come to you soon. Many of you go to VA medical centers for hearing aids. We're introducing an app on your phone so that you may not have to go to get your adjustments. You can do it right from home on your phone. So these are the types of innovations we're bringing. I hope some of you have participated in the Million Veterans Program. It's now the largest database in the country where it looks at genomic information to find new discoveries to help veterans and for us to do a better job. Our research organizations are doing terrific work. We're taking what we learn at one VA and now spreading it across every VA. This is our best practices initiative, and we're beginning to act like a single VA rather than individual VAs, and this is something that you're going to be seeing more of in the future. Our most important way that we measure whether we're making a difference is whether we have your trust. We know in April 2014 we broke that trust, and that's hard to regain trust once you break it. But in April 2014, 47% of veterans felt they could trust VA. Today that number's above 60%, and we're not satisfied with that, but we believe that we are slowly rebuilding that trust and should acting in a way that you should consider giving us back that trust, because this is the type of organization that we're focused on becoming. Finally, I just want to say that VA can and must become a top-rated customer service organization. J.D. Powers measures our pharmacy benefits, the way that we deliver pharmaceuticals, as #1 in the industry, above all the private sector benefits companies like Walgreens and others that do this. So if we can do it in the national cemeteries and we can do it in our pharmacy benefits area, we know that VA can do this in other areas. And so to do that, we're partnering with the best companies in the country, not-for-profit companies. Certainly, American Legion is a very important partner to us, but some of the other companies to make sure that we're learning how to serve you better. And your relationships and your partnerships to help us make sure that we're doing the right thing are critical. So I just want to thank all of you once again, and I'm so delighted I could be here this morning with you. Thank you very much.
Thank you, Doctor. Good to see you, sir. Thank you very much for what you're doing.